Greetings, Professor. The following presentation will be about assessing the return on investment from an information technology project. Information technology is used widely in organizations throughout the world these days. Information technology has the potential to increase efficiency, productivity, and revenues in your organization. However, increased use and availability is not always beneficial. Several IT investments made by organizations have not paid off. Morgan Stanley analysts estimated that U.S. firms lost $130 billion in unwanted IT systems. The failures and monetary losses that have resulted from information technology projects are so widespread and common that they cannot be due to mismanagement. Rather, the problem has to do with poor methodology in the cost-benefit analysis of IT projects. Therefore, it is essential that a newer and more accurate methodology be used in evaluating the return from an IT investment. The U.S. Department of Veterans Affairs is a government-run program that provides benefits for military veterans and their families, such as disability compensation, pension, education, and medical care. The Veterans Health Administration is a component of the Department of Veterans Affairs that implements the medical care program for over 4 million veterans in over 163 hospitals, 800 clinics, and 135 long-term care facilities and nursing homes. The focus of this presentation will be on VistA, which stands for the Veterans Health Information Systems and Technology Architecture. VistA is the electronic health record system used throughout the Veterans Health Administration facilities. As such, it is one of the largest electronic health record systems in the world. The following data was provided by the Department of Veterans Affairs on October 16, 2007. The data was provided by request under the Freedom of Information Act. The data depicts the budget of the Office of Information, the number of records in the VistA system, and the cost per patient index for the fiscal years 1998 to 2004. In the following slides, this data is analyzed for the strength of correlation by plotting it on a scatter plot and calculating the correlation coefficient using Microsoft Excel. For example, we would expect to see a positive correlation between IT spending and usage of VistA. The scatter plot shown here plots the cost per patient index against the budget of the Office of Information. On the left, you can see that Microsoft Excel provided the R-squared value of 0.796. The square root of this value was taken to determine the correlation coefficient, also known as R. This value can be between -1 and 1. The closer it is to +1, the more positively correlated the relationship between the two variables. In this case, the R value of 0.892 indicates that the IT budget and VHA cost per patient index are quite strongly positively correlated. This scatter plot graphs the budget of the Office of Information against the number of records in the VistA system. The square root of the R-squared value provided by Excel was taken to determine the correlation coefficient. The R value of 0.765 indicates a fairly strong positive correlation between the IT budget and the number of records in VistA. Of course, this correlation is not as strong as the one in the previous slide. This final scatter plot graphs the number of records in the VistA system against the VHA cost per patient index. Once again, the square root of the R-squared value provided by Excel was taken to determine the correlation coefficient. Since the R value of 0.566 is about halfway between 0 and 1, this indicates a moderately strong positive correlation between the number of records in VistA and the cost per patient index. So far, we have only looked at correlation. It is widely known that correlation does not equal causation. Therefore, in the following slides, causation between the data sets will be analyzed. Now that correlation has been reviewed, a causation analysis is required to determine the value of IT investment in the VistA electronic health record system. The main question to be answered then is, does increased IT investment ultimately lead to changes in the cost of care, Or do changes in the cost of care lead to greater investments in information technology and subsequent use of it? To answer this question, a causation analysis is used. The formula for this analysis is shown in the table on this slide under the condition to be met column. This formula was taken from a presentation by Dr. Alemi, who, by the way, is a fantastic instructor. PIC stands for the correlation coefficient between the IT budget and the cost of care index. PIU stands for the correlation coefficient between the IT budget and the number of records in VistA. And PUC stands for the correlation coefficient between the number of records in VistA and the cost of care index. All of these correlation coefficients were presented in the previous slides. Whichever of the two calculations above leads to a result of 0 is the model that will be accepted. As you can see, the calculation in the row highlighted in green leads to a result that is much closer to 0 than in the other row. Therefore, to answer the question asked previously, changes in the cost of care precede investments in information technology. The results of our previous correlation analysis demonstrate that changes in cost of care, as represented by the cost per patient index, resulted in IT investments and subsequent use of IT. This result is not the desirable causation. With healthcare costs rising in the United States at an alarming rate, it would be more desirable for increases in IT investment to lead to changes in the cost of care, and specifically decreases in the cost of care. Even if the desirable changes in cost of care did not occur, electronic health records still have other benefits, such as improved quality of care. However, before the results can be accepted, one must recognize the limitations of the analysis conducted. First of all, the data used may not be completely accurate. The Office of Information was recently reorganized, and the Freedom of Information Act officer that provided the data had provided only estimates of the budget prior to the reorganization. Secondly, the causation was determined using only 3 sets of data. There could be other factors that affected the cost per patient index or amount of IT investment that lies outside of the data that we analyzed. For example, there could be many non-IT related investments that affected the cost of care, such as increased use of medical procedures and diagnostic tests. Lastly, we have seen that the increased budget of the Office of Information was linked to increases in IT investments. The increased budget does not necessarily mean that there were greater IT investments. The money could just have gone to things that do not have any effect on IT, such as increased salaries for the employees in the office or upgrading the office furniture. Okay, well that's all I have to say. Thank you for listening.